that there's nothing to be ashamed of. The shame is going to turbocharge your out of control behavior and make it more compulsive. Normalize, okay, for me, this is where this comes from. I'm not a villain. I'm not a bad person. Bad things have happened to me. And I'm going to look at those things so that I can normalize and maybe then learn how to make decisions and be in control of my behaviors rather than my behaviors controlling me.
I'm Rachel, and you're listening to the Owning Your Sexual Self podcast. Hi, everyone. Welcome back for another episode of Owning Your Sexual Self podcast. I am very excited to have today's guest on with us. We have Dr. Joe Kort joining us on the show today. A little bit of background, Dr. Kort was actually one of my professors at University of Michigan when I was going through my certificate program for sex therapy and sexuality education. And I must say, he was one of my favorite professors. Very real, very raw, very down to the nitty gritty. Let me use air quotes of a woke therapist. And so a little bit about him before he jumps on here. He is a psychotherapist and also an LMSW and is the clinical director and the founder of the Center for Relationships and Sexual Health in Royal Oak, Michigan. I remember he opened this practice right around my time at U of M, and that was really cool to hear the journey of that. And there were some hoops that he had to jump through actually to get the name officially on the board there. And he is a board certified clinical sexologist, author of 7 books on male sexuality and LGBT issues, a lecturer and facilitator of therapeutic workshops. Throughout his 36 years of private practice, he successfully has utilized varying therapy modalities to help hundreds of individuals and couples improve their lives and strengthen their relationships. And Dr. Joe Kort specializes in marital problems and conflicts, mixed orientation marriages, male sexuality, and sexual health concerns, such as, again, air quotes, sex addiction, out of control sexual behaviors, sexual identity issues, childhood sexual abuse, LGBTQIA affirmative therapy, and imago relationship therapy. And I'm very excited. Again, he just popped into the waiting room, so let me get this show on the road. Thank you so much for listening to the show. We are focusing today on out of control sexual behavior, and I'm very excited to shed some light on this topic because there is a difference between sex addiction and out of control sexual behavior. So let me stop chatting here and let's do this. All right, welcome to the show. Thank you so much for coming on, Dr. Joe Kort. I'm happy to have you here today.
I'm so glad to be here. Thanks for inviting me.
Absolutely. And I was just sharing in the intro, and again with you, that refresher, we crossed paths many years ago. I think that was 17 or 18 that I went through that program. And then, yeah, so I feel this is almost a full circle moment. I was just a little sex therapy student back then. And
Wow.
here we are now both in private practice, which is really neat.
Yes.
Yeah. So I first actually learned about out of control sexual behavior when I was in your class, even though I think when you taught, you were, I think it was like the cultural class that the track that you shared there, but just the articles that you had us read, right? Like men having sex with men, not necessarily gay, right? Like just so many out of the box conversations I remember coming across in that class. And it was very eye-opening. Again, like I was very naive back then in my days coming into that program. But again, our topic today, out of control sexual behavior, that was the first time I've heard of that. I had heard of sex addiction, and so I thought we could start there. Can you tell us what is out of control sexual behavior and how does it differ from sex addiction?
Sure, definitely. And the class you would have taken with me, I was teaching the LGBT course at University of Michigan. And I was talking about how a lot of gay men worry that they have sex addiction or out of control sexual behaviors. And the difference is this: out of control sexual behavior is a model that's sexually informed and is sex positive. In other words, it's based on principles, not behaviors. So sex addiction, people don't know this. Sex addiction therapists have no training in sexual health. If they do get training, they have to go outside of that model and go get it somewhere else, which is actually what happened to me. For 25 of my almost 40 years of being a therapist, I was a sex addiction therapist, and I had no training at all. We get great trauma training, we get great addiction training, we get zero sexual health training. And when I finally did get my sexual health training from ASECT, American Association of Sex Educators, Counselors, and Therapists, I started realizing how harmful and what I now believe to be abusive the sex addiction model is, because it's not based on sexual health. It's based on or sexual information. So the therapist is left with their own bias in terms of what they think sex should look like, and they then impose it on the client. Where out of control sexual behaviors lets the client inform themselves.
And can you tell us, like, okay, so what are some of the triggers to out of control sexual behavior? How does somebody develop what we would coin as out of control sexual behavior?
There's so many different, and when we say out of control sexual behaviors, the person is feeling out of control is what it is. It doesn't mean they really are. They might be, but there's so many different reasons for why people experience this. They might have a really high sex drive and don't know how to maintain it or how to deal with it and keep boundaries around it. They may have had a history of childhood sexual abuse, and so now it's coming out as hypersexuality. They may be developing a new kink or fetish. Sometimes when we integrate a new kink or fetish, or we discover something that we enjoy, we experience feeling out of control because we have a hypersexuality period for it. When you're coming out, there's a stage of hypersexuality. Like we call it the delayed gay adolescence. So a person can feel an experience being out of control. But you can see in all these things, it's normal for the stage. It might be normal symptoms for some problem. So instead of what sex addiction does, it says, they'll say, well, this is what you are. We say, no, this is what you're experiencing. It's different.
Yeah. Yeah. And just that word addiction, right? There's such a negative connotation to that word. We think bad. And as you said earlier, right, out of control sexual behavior practices from the lens of sex positivity. And so again, not placing shame further on the client or the person that we're working with.
Right. 100%. I like that, from the lens of sex positivity. It's exactly right.
Yeah. And from my experience in working with clients that are going through this, it's comes to the point where they're having that urge, and then they're able to see the consequences, but they're overlooking those consequences, and they feel, as you're saying, like out of control. Would that be your understanding of it? Like, I know that there's a consequence, but I'm going to act on it anyways.
Yes, right. And so a lot of people say, well, then that's addiction, isn't it? No, the metaphor, I mean, the definition of addiction is that, but a lot of people like to say somebody coming out, let's say LGBT, right? So I don't want to be LGBT. I don't want to do this. And here I am doing it again. And I'm having the same sex I don't want to have. And so it sounds and looks like a sex addiction, but it's not. It's a discrepancy and a lack of acceptance of who they are. So they're going back and forth. Cross-dressers have the same thing. Cross-dressers will they'll have a binge purge where they'll buy all this makeup and women's clothing and wigs, and then go through whatever they do to enjoy it. And then when they're done, they throw it all out, and they experience it as being out of control, but it's only because they're protesting, I don't want to be this way.
And gosh, that must be very confusing for people that are going through this, and I know there's controversy against labels, but being able to give a name to it and have that better understanding of it, I think can be very refreshing for people when they're entering into therapy.
It can. And I think what happens is sex addiction is the low-hanging fruit. So if I have a sexual problem and I go in the internet and I'm looking around, sex addiction is going to be right there. And I think it comforts people to go, okay, that's what I have. And it comforts partners to go, that's what you are. So I'm either going to be disgusted by you and I'm married to a pervert, or I'm married to somebody sick who is a sex addict. It comforts people, but it's the wrong language.
And in your practice, do you see any gender differences in the amount of people that are coming to you with out of control sexual behavior?
It's hard because I get mostly male clients. I do see females, but I mostly get, and couples I get where the men have been discovered by their wives. So it's a great question. I don't know that I would know the difference. I don't think I could speak very well. The men usually are struggling. I know there's a difference. I just wouldn't know exactly how women do it differently. Although when women do it, what I have seen in my own personal, because I used to think I was a sex addict. So I used to go to meetings for 25 of those years. Not only was I a therapist doing this, but I would go to meetings, and women would do it more relationally with
Hmm.
people, and men would do it more transactionally. I will say that.
Yeah, interesting, interesting. Yeah, I see both men, all genders in couples dynamics, and I would say in my practice so far, it has mainly been white male, my white cis males. And yeah, that's interesting though. The amount of emails that I get that come through that are from the partners, the female partners, that my partner has this problem, right? They're a sex addict and then they enter into therapy. And then we realized, okay, no, like, how do you feel about operating under the lens of out of control sexual behavior versus sex addiction? And you could just see the relief, right? Like not feeling like something is wrong with me or I am this thing. It's pretty fascinating. But getting into that, let's talk about how do you see that this impacts relationships?
Hmm. So it's really hard because, people, it's an infidelity, right? Some people have gone outside the relationship, only it's all different variants of that, right? Some people may have just got watched erotica porn, right?
Hmm.
But some people may have had an interaction with somebody who's not even in their state or city, it might be in a different country. It could be that then somebody has actually met people, and whatever it is, it's a broken agreement, just like any infidelity is.
Hmm.
And they try to stop on their own, but they can't stop. It feels like they can't stop because many times they don't want to stop. They don't understand what they're doing. They don't have enough information within themselves to be able to stop. And so when it finally comes into the office, you're not just dealing with that out of control behavior, you're dealing with the injured partner.
Hmm. Yeah. And so if somebody is navigating this and they're wanting, let's say, to come forward with their partner and share that this is something that they're experiencing, do you have any tips, tricks, guidelines on how to have that conversation smoothly?
Really good question. It so depends on everybody, as you know, right, as a
Yeah.
therapist. But I'm not a big proponent of sharing everything. I don't believe that there's the difference between secrecy and privacy. And some things don't need or should not be shared, which is different than the sex addiction model, which also is not informed in relationship therapy. So, because of that, they do a lot of damage to relationships because they require the involved partner, the out of control partner, to share everything. And I don't agree with that. We've had a lot.
Hmm.
I remember when all that was going on when I was involved in the sex addiction community, and it would do more damage than good.
Yep.
So I might share with my clients, let's talk about what you've done. Let's talk about what is necessary to tell your partner and what is not necessary. But I know that can trigger people listening to this thinking, well, you don't get to
Hmm.
decide that for me. I want to know what I want to know, and I shouldn't be kept in the dark on things that like that.
Hmm. Yeah, but it's not your thing to know, right? Like it's that person's their autonomy to be able to come up with that decision on their own.
Right, right. Now, if they put their partner at risk, I mean, that happens, right? They're having
Hmm.
engaging in unprotected sex, and so could have, brought something back and transmitted to their partner. A partner should know that.
Hmm. Right. And which, right, for people that don't know, our model as therapists, like if a person is doing harm to themselves or someone else, right? Like we have our stipulations and guidelines that we're operating under, and so we're able to help them make that decision as best as it is for them. Whether or
Mhm.
not they do it is another story,
Right,
but
that's right.
and so from the other lens, let's say I'm a partner that's receiving this information from my significant other. How do I best listen? How do I best hold that space for them?
Well, I always say when I work with couples, I first work with the injured partner, right? So they need to go first and talk about their feelings, the big traumas around it, the little traumas around it, the betrayal, the gaslighting, all that stuff. And then it's then it turns into the turn of the out of control partner talking about and revealing, what happened for them, and me working with them about why they did this, what prompted this, what drove it. And I try to um, have the partner who's been involved talking about it with and having empathy for their partner. And even in infidelity recovery, the
Mm-hmm.
involved partner, and you can see I'm not using words like cheater and betrayed, because those are
Hmm.
words that bring up a lot of reactivity in people. So instead, I say the involved, which is the cheating, broken agreement partner, has to sit with understanding that what I did hurt you. And that's hard to do because we can sit with the partner who's hurt, but when you're the villain in the story, it's harder.
Hmm. Absolutely. Absolutely. And the importance it is for couples, I think, to have those conversations, to have those hard conversations, and whether it is in a therapeutic setting or not, but to have a therapist there that's present to help you guide you through that and help to be able to pause when we need, or if somebody becomes activated, like take that pause, resource yourself, redirect, like come back to it. And yeah, this isn't, I'm assuming, or in my experience, the same. Like it's not just a one conversation, a one and done. It's an ongoing conversation.
Could take years. They sometimes people report in
Hmm.
the research 5 years, but 5 years doesn't mean that it's going to get better. It won't get better until 5 years. It means it's getting better during those 5 years, and it becomes part of your relationship. People, you don't get over it. People say, I don't get over it. You won't get over
Hmm.
it. You'll work through it. It'll become part of the fabric of your marriage.
Hmm. Yeah. And you spoke to this a little bit earlier, but just speaking to some of the shame and the stigma that is placed on somebody, as you said, that this can develop over time from a lot of childhood things. Can you speak a little bit more to that? There's this shame that's placed on us for somebody that is experiencing out of control sexual behavior.
Yeah, you mean like from childhood, like religiosity, religious
Hmm.
shame.
Hmm.
We actually, the numbers are really high. You talked about having white male uh, men who self-describe themselves as sex addicts or out of control. It's
Yeah.
usually because they have a moral conflict with what they're doing. They're usually highly religious. They're older white men. There actually is a high percentage of Black women that are overdiagnosed with sex addiction. And again, that's the whole stigma of Black women being too sexual and how they should express their sexuality. So there's so much judgment toward these people and toward themselves, and culturally and outside the culture. And so that has to be sorted out as well. And because there's shame that
Hmm.
comes with that.
Hmm. Yeah. Yeah, and again, this is just such a tender topic, right, for somebody that's experiencing this. And so certainly, Joe, I know you have your practice, you have plenty of therapists there that are working with this topic. And so they're just for people that are listening that are thinking like, oh, this is me or this is my partner, there are resources out there for you to be able to reach out to and get support around this. And I think the field of sex therapists and sex counselors is definitely been growing more and more over the years. And so finding somebody, as you said, like somebody that actually has specialized training in these sorts of topics is uber important.
And somebody that has some type of training in sexual health. You really
Hmm.
don't want to go to a therapist who doesn't have it, because otherwise they're not informed. They're not going to be able to help you. They're going to have a bias in the room.
Hmm. Yeah, absolutely. And I think you can probably relate to this, but when clients get into this type of setting, just again, the relief that you can see that washes over them when they're sharing something that felt very big for them. And then to not, right, like get the, oh my gosh, right, like that sort of reaction, like we get to normalize people's experiences for them, which I think is very powerful.
Very, what we do and end up doing as therapists is something's not wrong with you. Something was wrong that was done to you. And you're
Mm.
returning to the scene of the sexual crime. So that's what I talk about. The sexual crime happened to you in your childhood, most likely. It could have happened in your adulthood. It could have been a rape, a broken agreement from an aunt, an uncle, a grandparent, a father, a mother, whomever who betrayed you and violated you in some sexual way. And now you're repeating that. It's called trauma repetition. We know that as therapists. And you
Hmm.
return to the scene of the crime trying to solve it this time. But there's no solving it by recreating it.
Mm. Yeah. And so if somebody that is experiencing out of control sexual behavior, is there a point to where they are healed, let's say? I'm trying to like give the best language around this. Like, is just one day you're it's yeah, healed, it's the problem solved, right? It just stops.
It's not so much that, it's more of, can I, it might, some people achieve that. A lot of clients come to us that then they want what's called an erotic ectomy, right? Just slice this out of my head and get it out of me. And that's impossible. Usually people are pretty much stuck with the fantasies that are in our head. It doesn't mean we have to act on it. We can lower the volume on it. But it also, most people, I talk about going from trauma reenactment to trauma play. So
Mm.
they embrace it, and I can get off on this and get into this in a way. If I do my healing around it, if I work through my childhood essay, I'm saying essay because on TikTok You can't say sexual abuse. So I'm talking like I'm on TikTok.
Yes.
Childhood sexual abuse or whatever trauma occurred for me or whatever religiosity or moralistic views were dumped on me or growing up LGBT and having to repress myself and oppress myself and suppress myself. So now maybe this experience that I'm having that feels out of control is only out of control because I'm at odds with it. We have a really good line in the
Mm,
sexual health field. If you go to war with your sexuality, you will lose and cause more chaos than before you started.
mm,
And that's the case for a lot of the people.
hmm. Oh, that should be the tagline of this episode. I like that.
Isn't that great? It was Jack Moran who said it.
Yes. Oh, I love that. Yeah. Oh, author of Erotic Mind, right?
Yeah, yeah, yeah. He was great.
Yes. That is a
Yes.
great book too. Yes. Yeah, so this is right. So again, so to recap, there's not a period, there may be, but likely not going to be a period to where you are recovered from this, you've healed this, but if you can step into more of an accepting of yourself and your sexuality, that is the secret sauce, if you will.
Right. So here's an example I'll give you. I had a client who was sexually abused as a child, and he was reenacting that as an adult. And so when you're in trauma reenactment, you are breaking your agreement with your partner, not telling them and doing it secretly. You're experiencing out of control compulsive behavior, and you might be putting yourself at risk for HIV, for STDs, for legal consequences, physical consequences, medical, whatever. When we did the healing around his sexual abuse and he was able to connect, oh, that's what happened. And then he confronted his perpetrator and he did EMDR and he was in a men's group and he went to a men's workshop. And it took us a few years to really help him with his healing. The fantasies of what he didn't go away. He still enjoyed those kinds of things. So he went to trauma play in that now I make an informed consent with my partner. I have a conversation with her and have her agreement in my negotiating this in our relationship. I'm no longer compulsive around it. It's not in control of me. I'm in control of it, and I'm not putting myself at risk of anything. I'm doing it, and I'm protecting myself.
Mm-hmm. Yeah. And how healing can that be of that just that sense of being able to take your power back from that trauma that occurred in
That's a
earlier in your life?
great way to say it. Yes.
Mm, yeah. Oh, gives me goosebumps. So you were just mentioning a lot of resources, things that people can do. And we're both from Michigan, but can you share some of those things that you know about that might be more local or even out of Michigan?
Oh, that's a great question. I don't know of a lot of resources. I know a lot of people, I have to admit that they'll go to Sex Addicts Anonymous because there's nothing else out there.
Mm-hmm.
And the problem with Sex Addicts Anonymous is people are trying to stop a behavior they can't stop or maybe shouldn't stop. Maybe there's a way to address it in a more positive way, but they don't know that in those groups. So they'll say, I have 30 days sobriety, or I just lost, my year of sobriety. So now I'm back to day one. And it's very discouraging. The only good parts of these groups are that there's community and
Mm-hmm.
accountability and sponsorship. And I love all that for people. And a lot of people get a lot out of that. But other than that, I really don't know of any resources out there other than the book Out of Control Sexual Behavior by Doug Brown Harvey, which is a
Mm-hmm.
hard book to get through. He
Yeah.
admits that, even as clinicians, don't you think? It's like, so he's writing it for non-therapists, and there should be a easier read at some point.
That is very good to hear because yeah,
It
it's a
is.
thick like textbook style.
Yes.
And pricey, for someone that's, maybe trying to do this on a smaller budget.
Yeah. Now, one other thing people do is sometimes they'll get on an antidepressant or an SSRI because it reduces libido. And
Hmm.
that's a side effect of it that most people hate. But for somebody with out of control behavior, it can feel like a relief. Like, finally, I have something that is helping me because it's out of my control until I tell him get control over it.
Hmm. Yeah. And for somebody that was wanting to do a non-therapeutic route for this, did you have any suggestions around that?
I don't. I wish I did. I know
Yeah,
I
I
don't even know
know.
what's out. There's no support groups for this other than the
Yeah.
addiction groups. I don't know.
Yeah. Yeah, my recommendation is generally, books, podcasts, but even before reaching out to you, looking up podcasts around out of control sexual behavior to be able to share with clients as a resource, there's really not much out there. And so that was for me, I'm like, we need to have this episode, very soon because I know I'll be sharing this a hell of a lot with people that I encounter.
And for people to recognize that you need to get to the root of this. What is this really about? Maybe it's just normal. Maybe I'm just kinky. Maybe this is I'm in a wrong relationship because my partner doesn't like it. Doesn't mean something's wrong with me. It might mean that there's something wrong with the partner I've chosen in terms of the connection that we have. I mean, there's so many reasons that are already existing without us giving it another label.
Yeah. And do you see, as we trend into the future, do you see any changes happening around out of control sexual behavior? Do you see it increasing, decreasing, us having more information around it?
That's a great question. I know we have more information, but people don't get that involved in it. They just go to Google and get the low-hanging fruit and come
Mhm.
into my office and they're dealing with that. I don't know if I see more of it. There might be more experiences. I know in the gay male community, let's say, because of the apps like Grinder and Scruff and Sniffies, they don't close down, right? They're open 24/7. And I've had gay men in my office say, well, I'm hooking up with this one guy. He's already on his app looking for the next guy. And they feel like
Mhm.
complete loss of control, but it's because they don't know how to manage their own and regulate themselves to shut the app down, get some distance from it and really uh, get a aerial view of what's happening. They get too immersed in it and then they don't want to stop because it feels so good.
Mhm. Mhm. Yeah. And right. And then the saying goes, right? If it feels good, why stop?
Right, right.
But yeah, if it's yeah, therapeutic setting again, I think is definitely the way to go because as we already talked about, you're digging into past experiences, we're digging into trauma, whether that be that big T trauma, little T trauma. I mean, so many things could have occurred that are leading you here today. And I think it's often to have somebody again with this education and with this knowledge to be able to mirror back what it is that we're hearing from clients and patients and whatnot, because sometimes it's right? We share our story and we ourselves, I've experienced this in my own therapy. I share my story and somebody else is like, wow, right? Like reflects back what they just heard. I'm like, oh, right. I never even realized that's what was happening or that was that.
It's so good to be able to talk to other people. I will say, when you're talking about resources, I would recommend that people stay away from anything that describes this as a sex addiction. There's a
Hmm.
book called Compulsive Sexual Behaviors by Silva Neves. We have the Out of Control Sexual Behaviors by Doug Brown Harvey. We have podcasts with both of those men. I've done my podcast with both
Hmm.
of them. So, but I would stay away from and really, I would be more inclined to recommend they go towards sexual health resources and learn
Hmm.
and there's a great I'm going to forget the name of this website. I'll think of it, but there's a great
Yeah.
sexual health website that people can go to and it's free, and I'll think of it while we're talking.
Hmm. But even the ASACT website, right? There's resources that people can find there, clinicians that people can find there. I love the sex positive families. Anybody, yeah. And I think when you come across, Instagram or TikToks or things like that, you can tell if you're receiving that content and you're feeling good, you're feeling empowered, you're not feeling shamed by what you're experiencing. That's the good content, right? Like that's probably somebody that's operating under sex positivity.
Yes.
Yes, which, okay, so as we're wrapping up here, you're on TikTok, you're on all the social media things. Share with us how people can find you, or if people want to work with you or somebody at your practice, how can they get in touch with you?
Sure, thank you so much. So I am on TikTok, LinkedIn, Instagram. All of my handles are at Dr. Joe Kort, DrJoeKort. And then they can go to my website, joekort.com, and there you'll find my podcast and all my books and different information. And I'm happy to answer questions if people. I mean, I can give resources on my
Mhm.
website, but I can't answer therapy questions.
Yes, we're not providing therapy through social media.
Oh, no.
I know. I love when those questions land into my inbox. I said, this is not a one sentence answer, my friend.
Right, right. I know you get them too. Yes.
Yes, yes, yes. Well, thank you. Is there anything that we didn't cover you think is worth mentioning on this topic before we wrap up here?
Just that really, I think what you and I do for a living is get rid of people's shame, that there's nothing to be ashamed of. The shame is going to turbocharge your out of control behavior and make it more compulsive. Our job and your job as a person is to normalize, okay, for me, this is where this comes from. I'm not a villain. I'm not a bad person. Bad things have happened to me. And I'm going to look at those things so that I can normalize and maybe then learn how to make decisions and be in control of my behaviors rather than my behaviors controlling me.
Hmm. Yes. And, and for the partners that, right, again, might be on the other end of this, offering that space, like space holding from the lens of curiosity, empathy, right, just having an understanding for somebody instead of immediately going into shaming, making them feel bad. That's not benefiting your relationship in the long run. And as you mentioned prior on this episode, right, sometimes we come to that realization that I'm in the wrong relationship. And so that may be, and we know that's also a very hard decision to come by as well. So, but that might be the case. And if right, ultimately parting ways is what's best for both people, that's best for everybody that's involved, right? So,
Yes.
um, but as you said, there is a really nice, beautiful, and creative side to this as well. Somebody that does step into more of that acceptance, and especially being able to step into the acceptance within their relationship. That just sounds very fun, right? There's so many more opportunities and possibilities that can open up for the couple.
Yep. If they're open to it. Yes.
Hmm. Hmm. Yeah. All right. Well, thank you so much, Dr. Kort. I appreciate you again coming on the show today. As I said, I really definitely see this as a resource for many people moving forward.
Thank you. Thanks for having me.
Thank you so much for listening to today's show. If you loved it, be sure to subscribe so that you never miss an episode. And if you really fucking loved it, make sure to tag me on social media at @TheRachelMain. I'll see you next week.